Hi, this is Dr. Raghavinder, and today I'm talking about hyperuricemia and gout. Hyperuricemia is a condition of high uric acid in the blood which causes joint related problems. High uric acid can cause acute onset of pain in joints, more commonly in the foot. Other joints can also be involved, however, the toe and the joints of the foot are very commonly involved. Usually the pain is very severe and is relieved only by painkillers and sometimes by steroid injections into the joint. People who have an attack of gout are very likely to develop recurrent attacks of gout during their lifetime. Risk factors for gout are alcohol intake, obesity, diabetes, the use of diuretic medication. Diuretic medications are the ones like hydrochlorothiazide and chlorthalidone, which are a very common component of hypertension drugs. Sedentary lifestyle and increased red meat intake and increased intake of fructose drinks also predisposes to hyperuricemia and gout. The treatment for gout is initial pain management. However, long-term prevention of attacks is only through lifestyle modification, through cutting down alcohol, reducing red meat, better control of diabetes. Medication for gout involves drugs that reduce uric acid levels. However, these drugs are usually not started at the time of a acute gout attack because starting these medications can worsen the pain. They are usually started after a few days, 1 to 2 weeks after the attack has subsided. Patients with more than 2 attacks of gout are usually started on uric acid reducing medication, and this medication is usually prescribed lifelong. People who do not adhere to lifestyle changes and who do not take medication regularly are predisposed to recurrent gout attacks. Recurrent and repeated gout attacks cause permanent damage to joints, and sometimes polyarticular gout can also happen. With polyarticular gout, the joint damage is not restricted only to one joint. Other joints like elbows, shoulders, knees are also involved. That is why once you are diagnosed with hyperuricemia and gout, it is always better to follow doctor's advice for treatment.